Hello everyone, welcome back to my YouTube channel Physio Talks and Tips. So today I'm going to discuss about the bone clavicle. So before that, don't forget to click subscribe if you want more weekly updates. Hello everyone, today I'm going to discuss about the bone clavicle. So clavicle is a long bone. It supports the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmits weight to the limb to the sternum. The bone has cylindrical part called shaft and the two ends called the medial and the lateral. So this is the right clavicle. So how we find the side of a clavicle? The following characters help us to find out the side of a clavicle. So this is a right clavicle. The lateral end is flat and the medial end is large and quadrilateral. So this is the medial part and this is the lateral part. The shaft is slightly curved so that it's convex forwards in its medial 2/3 and concave towards the lateral 1/3. The inferior surface is grooved in longitudinally in its middle 1/3. The peculiarities of the clavicle includes it is the only long bone that lies horizontally. It is subcutaneous throughout. It is the first bone to start ossifying. It is the only long bone which has two primary centers of ossification. There is no medullary cavity. It is the only long bone which ossifies in membrane. It is occasionally pierced by the middle supraclavicular nerve. It receives weight of upper limb via lateral 1/3 through coracoclavicular ligament and transmits weight of upper limb to the axial skeleton via medial 2/3 part. The shaft is divided into two parts, the lateral 1/3 and medial 2/3. This is the medial 2/3 and this is lateral 1/3. The lateral 1/3 of shaft is flattened above from downwards. It has two borders, the anterior and the posterior border. The anterior border is concave forwards. The posterior border is convex backwards. This part of the bone has two surfaces, the superior surface and the inferior surface. The superior surface is subcutaneous and the inferior surface presents an elevation called the conoid. This is the conoid tubercle, and the ridge is called as trapezoid ridge. Trapezoid ridge. The medial 2/3 of the shaft is rounded and it have four surfaces: the anterior surface, posterior surface, superior surface and the inferior surface. The anterior surface is convex forwards, the posterior surface is smooth, the superior surface is rough in its middle part, the inferior surface has a rough oval impression at the medial end. The lateral half of the surface has a longitudinal subclavian groove. The Radian foramen lies at the lateral end of the groove. Next is the lateral end. The lateral end is also called as acromial end. Acromial end. It is flattened from above downwards. It bears a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. The medial or sternal end. The medial part is also called as sternal end. It is quadrangular and it articulates with the clavicular notch of the manubrum sterni to form the sternoclavicular joint. The articular surface extends to the inferior aspect for the articulation with the first costal cartilage. So this is about the anatomy of the clavicular bone. So, the muscle attachment of the clavicular bone will be discussed in the next part